Guys, welcome to my YouTube channel. My name is Ruth Kerupa. In case you're new here, karibu sana. So today I want to focus on the state of health in our institutions. So by now I'm a teacher, so basically I'm an educational stakeholder, and I wanted to bring to your attention, you parents and other stakeholders, about the state of our health generally for students. Before you enroll a student to a school, you need to ask yourself key questions. You start from the administration. What mechanisms do they have in case a child is feeling unwell? For example, is it the matron who will administer drugs in case they get maybe an injury, nose bleeding? Do you have functional first aid? It's so embarrassing that sometimes some schools, the shopaholic schools, don't have functional first aid kit, and even if they do, they don't have the first aid skills, and that's so shameful. I mean, in this day and age and era, those are things like, it's like owning a vehicle. You need to have a first aid kit, because accidents are bound to happen. You don't know, it can happen to you. Like, there's a day I was in the staff room, then there were some glass that had been put on sliding on a wall. Then, just checking about the KCSE timetable, I accidentally hit one of the glass, and it led to some injuries on my legs. Now, in that state of bleeding, there's no first aid, so you're like, fine. You put salt, still the bleeding is there. You're not finding even cotton, so you start using some paper. But good thing I was brought ethanol from the lab. I don't know whether it was contaminated or not, but it really helped me. It was put in a baker. So that is it. So you need to ask yourself whether the school has even a functional first aid, or first aid, before you now get specialized medical help. Pawe na huduma ya kwanza kabla ya huduma ya dharura. Kabla ya huduma ya dharura, lazima pawe na huduma ya kwanza. Uliza kama ipo. Another thing you need to ask yourself, in case your child gets ill, what is the policy of the school? Who will inform you? Is it the class teacher? Is it the principal? Is it matron? Is it anyone, even the workers? Sometimes children can fake sickness. Though sometimes I feel we tend to, because we want to ensure they are retained in school, we can just be saying like, basi hata ni kama hata si mgonjwa, and you're retaining them for long, and it could be disastrous. Right now, human life is so delicate. Someone could even be complaining of migraines. The next minute they are no more. So how serious will their medical situation be taken care of? Do you have even a sanatorium? And if it is there, do you have a certified nurse, someone who can diagnose and say, you know what, this is what this child needs? Maybe they are having cramps, menstrual cramps. Let's say it's in a girls' school, so they can be given the painkillers, the hot massage bottles, nini. If the pain persists, then what action should be taken? Is it the school's responsibility to take now the child to hospital, or is it the parents who will be called to take the child to hospital? Because we don't want a situation whereby it's too late. Maybe a child has camped in school, and we start acting like we need an explanation. What explanation do you need if you didn't ask these tough questions from the word go? So let's not be careless as parents. And if it's now the school's duty to take your child to hospital, you need to ask, who will now finance? Is it the school? Is it you? Do you have a medical insurance? No. Right now, we need to get serious. It's actually God who is protecting our children. after this Ruto government, there is no longer that need for UPA where you just could log in and access free Medicare. Right now you have to go into your pocket. So is it the student who will remove their pocket money? And if so, what happens next? Will they be compensated by you? Or need to ask. Like, there's a time when I was in high school about the specs. You realize specs are very important for people who don't see properly, so it is a must. So do you even does the school have a policy, for example, for some of the specialized care they should be done over the holidays? Medical attention as far as dental is concerned, ears, nose. Sometimes you find a child has come to school with toothache, and they start borrowing permission a day after reporting. Surely it doesn't make sense. What were you doing during the holiday? So let's not even make some of these things to be an emergency. If they are bound to happen, just take care of them during the holidays. Do if it's the changes for the lenses, for the braces. If a child has an ingrown growth, go and make sure it is dealt with during the holiday, and they start healing. And when they come back, let them come with a medical note for uniformity. We don't want a situation whereby your child is in slippers, I don't know, these Crocs. Actually, for Crocs, it's a menace. So we need to have uniformity. So for that, it's good the child comes with a medical report, so that they can be given the exemption sheet by the teacher on duty or the class teacher, that states the reason as to why they cannot be part of be wearing school uniform fully. Yeah, so that's another thing you need to take into consideration. As a parent also, you need to do a follow-up. Your child maybe was sick at home, they were having ulcers. What do you do about it? When they reach to school, try to have open communication even with the authorities. That doesn't mean that now you'll be coming anyhowly to school. Yeah, just do a follow-up, ask whether they have recovered, are they taking their medication. Yeah, no, sorry to say, but some you find that victims of HIV, they were born with it and they have to be on ARVs, sometimes due to they fear stigmatization. They might not be taking the medicine as it's supposed to be. So you need to do a follow-up, because those drugs are helpful as far as longevity. Is it longevity or longevity? Yeah, so that they can live longer. Yeah, so to extend life, you need to consider that. Another thing, you need to ask your child, how do they feel about their school when it comes to medical issues. Like, is it a school that will be like, hata huko vibaya, maybe it's on a weekend and there's a long process involved. And sometimes as parents, we need to be responsible. For example, your child keeps on fainting, then when you're called in, you don't take them to hospital. I don't know, it's poverty or it's ignorance. Then you take your child for prayers. We don't say that prayers are bad, but come on, let's be realistic. Go to hospital, get a clear medical report about this child. Let medication start. Get to know even the root cause of their problem. You find we subject our children to problems, like now they'll miss school, because who will want to readmit a child, especially if they keep fainting over and over again? And you're like, is it hysteria? Is it shock? And they miss even on exams. Imagine. So as parents, it's high time we become intentional about health of our children at school. And it begins by you asking the questions. Do you have the equipment? Do you have the emergency system on what to do, like maybe evacuating the child to hospital. In case of transfer, will you be contacted, or the child will just be sleeping in the dorm? What happens? So finally, how are common illness dealt with? Ni kupewa painkiller inaishia hapo, or will they go for diagnosis? Yeah, nimewakelelesha, but I hope you found this helpful. Please subscribe, like and share. I look forward to engaging with you, so please comment. I do a lot of work trying to provide solutions for you, so it will be good if you reciprocate back by leaving a comment, by engaging with me. Yeah, because I look forward to hearing your side of the story. Until next time, bye.